Hello, I'm Professor Patrick McGorry. Welcome to today's webinar. Before we proceed, as Executive Director of Orygen, I would like to acknowledge the traditional custodians of the land on which we work around Australia and pay my respects to elders both past and present.
Hi, my name is Craig Hodges and I'm the Director of National Programs here at Orygen, and today I'm here with Kira Mansfield, who is the
General Manager of Service Innovation at South Eastern Melbourne Primary Health Network.
Thanks, Kira. And basically we want to, have a conversation today about commissioning and what it means to commission services, particularly for young people in the sort of primary mental health care space, and thinking about how organisations can become commission ready, but also talking through some of the challenges associated with commissioning, because it's a relatively new concept in Australia. So we'll take you on a bit of a journey today about what our experience has been, and along with Kira's experience being a PHN who commissions services. So in terms of starting off and sort of thinking about context setting, youth mental health is obviously a relatively new area of service delivery. Even though it's probably been around for 10 years, it's still relatively new. We've obviously seen the establishment of headspace centres in the last 10 years, and since then, particularly with the advent of PHNs, we've seen specific money that's been then allocated to commission new youth services, particularly young people with more complex and severe mental health presentations. And so I think that's been a really interesting shift in terms of thinking about how then do we go about trying to commission services that are appropriate for young people. So maybe if you want to start, Kira, by just talking a bit about your experience at South East Melbourne.
So I think first of all I'll start by saying we welcome the additional funds, any funding towards improving the mental health and outcomes for young people in our region. In South Eastern Melbourne in particular, we are particularly lucky because we've got obviously the Headspace platform, so the early intervention and prevention space, but also manage the youth early psychosis program. So that gives us a continuum of care, but obviously then we've got that gap, in the middle, and this is for the young people who are severe and complex mental ill health. We're welcoming the funding to obviously look at what types of service we can put in to capture, the needs of those young people in our region. And it will be different for all PHNs, Craig. Obviously we're a metro site, depending whether you're rural or remote, what are the services you have and what your workforce capacity and capability look like will obviously determine what services we have on the ground. But from our perspective, we started with looking at the needs assessment and then did a gap analysis. So what is it that we have and what's missing, and how can we fill that gap?
Okay, so I guess that segues nicely into then thinking about what is commissioning, because it's still relatively new in an Australian context. It's obviously been well established in the UK and New Zealand for a number of years, and obviously with the advent of PHNs back in 2015, the sort of notion of commissioning, was introduced. And so it may be good if we sort of, start there and thinking about what does that mean, because I think, again, people have probably different understandings of what commissioning is, what the commissioning process is. So maybe you just want to talk us through a bit about, from South East Melbourne's perspective of what commissioning is about.
Happy to. For a lot of PHNs, obviously at this point in our journey, because we've been around now for 3 years, all PHNs will have established a commissioning framework, and the key principles are the same. So the stages and approach to commissioning would be pretty similar across the country. But in particular, when you're looking at commissioning of any service, but particularly youth mental health, you're looking at what is your needs assessment, what is that target, and you take a strategic approach to commissioning. From our perspective, what we're looking for is obviously an outcomes-based and evidence-based procurement of services. So in the first instance, we look at, having done the needs assessment, having done the gap analysis, having a look at, well, what is it we can procure? What does the market look like? Who's ready to deliver those services? Do we need to build a market? Is it already there? What is the workforce capability? And then the next stage is then obviously thinking about, we've worked out those parts. The next element is, well, how do we co-design? And co-designing, we can probably talk about that in its own right later on, but a very important and critical element very early on in the piece. And it's not something that you do as a once-off. So certainly at South East Melbourne, we look at it from every perspective. So we co-design in the very early stages with community. We've got a community and a clinical council that's obviously appointed at the PHN, as do the others. I think community engagement in particular is important. And this is where we reach out to young people to understand what they want and what their needs are. You know, a lot of us are a bit older in this space. And, you know, what we think would be appealing to young people isn't necessarily the case.
Sure.
Now, I guess from some PHNs who may not be as familiar with Headspace and the early psychosis program and Orygen more broadly, there's a wealth of youth reference groups to tap into. So I think it's not that there's a lack of understanding, I guess, in the community. There are a wealth of young people out there with amazing backgrounds and so much knowledge, and they love to share. I think, you know, once you create that environment, a safe and comfortable environment for young people, and they open up, it's so rewarding, and obviously will ultimately shape and determine the success of your program.
So you talk, I guess there's a couple of things there you touched on, in particularly thinking about the sort of undertaking a needs analysis and looking at sort of what gaps sort of exist in current service provision. So I guess what are some of the things that you look at in terms of determining sort of needs? So, you know, is that sort of a broad sort of environmental scan and looking at what services are already out there, and then looking at, you know, obviously funding might be targeted in a particular way. So if, you know, if those services aren't being provided, is that then part of trying to fill that gap?
So it's a range of different things, and I think from a PHN's perspective, because we are talking about a local catchment, so it's not a national program per se, and you're really trying to tailor the programs to the needs of your local community. So the first thing we'll do is look at the social determinants. I think, you know, because obviously they have a huge impact on health outcomes. So we'll have a look at the areas of psychological distress, perhaps rates of family violence. You know, there's major risk factors. We've got a fantastic data and evaluation team at South East Melbourne. So they do a huge amount of data gathering and have a look at and overlay it onto various maps within our catchment. Usually that will tell us what services are there, but you can look at a map and say there's 25 youth services, but it's, well, what do they deliver? What's the composition of the FTE? What are their expertise? It's no good just knowing that there's 25 services that will deal with young people. So we have a look at the areas of need, and usually when you bring all of that data together, and certainly from the presentations that we've done with community, you'll see from our maps that things will jump off the page in terms of where you need to locate your services, and what the uptake will be, what the prevalence rate is of certain disorders. And you take all of those things into consideration and think, well, where are you going to have the highest impact and make, I guess, well, the highest impact, the best outcomes. So rather than spreading money, I guess, like confetti across the entire catchment, so we are there to service all of our community, but there are high pockets of need in some more disadvantaged areas than others. And I think that's where the PHN then can really add value in terms of commissioning locally.
And I think that's a really good point, because I think some of the, you know, I guess from our perspective as an organisation that works with, you know, all 31 PHNs, sometimes we've seen PHNs who've gone down that path of wanting to sort of spread resources quite thinly, you know, I guess wanting to sort of service as much of their catchment as possible, recognising when you have a particular amount of money that you clearly can't provide services to everyone. So it is about making those, I guess, critical decisions about where where need is greatest and the type of service that you might want to, you know, sort of position in those particular areas.
That's right, and I think the service mix is important. And I think this is where our relationships within the primary care sector can obviously add enormous value as well. So you need to look at and leverage from as many platforms as you currently have. So you have a Headspace platform, you can leverage from that. The consortium partners that make up and contribute to the delivery of care for young people. And then not to underestimate the value of GPs. I think we forget sometimes that, you know, the majority of young people and their families will always present at a GP practice first and foremost. So it's not necessarily about can we build something and put something somewhere so people can come to it. It's more about, again, having that reach and access and flexibility, but obviously wanting to reach as many people as you can without diluting the service too far.
So I think you've hit on a really important point there. I think, you know, Headspace is obviously a really good example where in, you know, communities they're often quite well established they're a known brand for young
Mhm.
people, so they've got, I guess, a reputation in the community of, this is a safe space for young people to go and access the types of help that they,
Yes.
would ideally like to be able to receive. So I think being able to build on that is a really critical thing. And when we talk about, the notion of sort of supporting young people with sort of more complex and severe presentations, who largely at the moment, I guess, are what we often refer to as the missing middle. There is no sort of service provision for that particular client group. So, that's where there is capacity often, I think, within Headspace to sort of build that platform to provide that next layer of service.
Absolutely. And even if the service isn't directly delivered from a Headspace centre, I think it's important to understand what the capacity of each centre can do to support this particular client group. Obviously the maturity of that centre, its integration with primary care and all of those things, it varies throughout the country. So I think each PHN will have to look and understand what its Headspace cluster can do in terms of supporting this particular client group. The ones who are, I guess, who've been around for a long time are already servicing this client group. Not well, because obviously they're not funded to do that, but there's the no wrong door approach. So I guess if a young person presents at a Headspace centre, it's, well, what can you do to support that centre to for that client to receive the care that they need? And if they're not, what can their consortia partners do? But more broadly then, if you're discharging somebody in and out of the tertiary service and then back out into primary care, what role can that GP practice play? So I think there's a lot of capacity building and understanding that needs to be done to make the system work. And we're at that very early stages right now.
Absolutely, I would agree. I guess one of the important points too is thinking about, because some of the people who might be watching us today might be thinking about, okay, I'm a service provider and would like to sort of look at how I can become a commissioned service. Are there things that organisations can do to become commission ready, so to speak?
I think there are, and that's a really good question actually, because the market is really being tested right now. Commissioning is new. Some organisations are better at responding to tenders than others, but a good tender response is not necessarily always the answer either, because people circumnavigate the system. You've got really good tender writers and so on and so forth. So it's not necessarily about how you write the tender, I would say. It's more about organising yourself in terms of what you think the value you can add in this particular space. A lot of it really is around the workforce that you can bring together and the capacity that you can build to deliver the services. So I think we find that when we go to market generally, we get a very good response in terms of the number of submissions that we might get to any tender, but in particularly I think to youth at the moment, because the profile has been raised around youth mental health. It's an area of interest now for most people, and I think the workforce is keen to work in this space. And I guess that's where the advantage of Orygen and Headspace and other organisations who've been in this space for a while can attract that workforce too. So it's, in terms of getting yourself ready, I would suggest that you partner with as many organisations as you can, because it's difficult to deliver a whole suite of service elements on your own.
Absolutely.
We're not building anything, so we're not building a building that people can occupy and then deliver a service from. So it's really about, you might have great operational capacity, you might have a great brand in your own right, whoever that organisation might be, but then it's demonstrating how you can bring those other services and organisations together to deliver the best outcomes for clients.
I guess that's one of the challenges with sort of commissioning, is because at one sense, because it is going out to the market and asking the market to respond, but at the same time it is about how organisations collaborate together and come together in the best interest of providing the optimal services for clients. And I think maybe that's sometimes where we all fail in terms of putting organisations' needs first rather than client needs first.
Look, we do, and it's also a difficult time, because obviously this is a competitive environment as well. So we're asking people to collaborate, and on the other hand, we're saying, but then when the tender comes out, it's it's competitive. So it's almost a contradiction in itself. So some of the things that we've done to combat that is to talk to organisations about, we're happy to, if the submission is well structured and you can show that there's clear governance in place for subcontracting or a consortia partnership arrangement, but it's got to be a true consortium partnership arrangement, not a lead agency that will say, I'll do this, that, and the other, and then you've got no real buy-in. So I think it's really important if a range of organisations are going to come together to deliver a service, they demonstrate that through their tender process, and they take that time to really understand who they're partnering with, and demonstrate to the PHN that this can work.
No, that sounds great. In terms of, you touched on before co-design, because I think that's a really critical process that sometimes, again, I think there's a very varying sort of understanding of what co-design is and what the process is and how you go about co-design. And I think, we've seen some examples of co-design with service providers, but not necessarily involving the client group at the end of the day. So I think it'd be interesting to hear from your perspective about, how you go about approach co-design and the process, I guess, for your particular PHN.
Sure. And I would agree. I think when you get a group of PHNs in a room and you ask, if you went around to each table and said, how do you co-design? You might get a slightly different answer from each table. But I think in the context of what South East Melbourne does in particular, and I might read you what we do because we've just written it down, so we don't deviate too much from our co-design principles. So essentially, in the context of commissioning, co-design can be used in several ways. So it's to identify the roles and aims of the commissioning process, to identify and assess need, to develop agreed outcomes, to determine how services are delivered, to determine what data is required, to develop health and well-being activities that enhance self-care and the community's ability to stay well and healthy, and to ensure the activities developed are culturally safe and appropriate. Now, there's a range of co-design elements, if you like. How you involve community, and particularly young people in this case, you can involve them at every stage. There's absolutely no reason why young people cannot be involved at every stage of your co-design process. So from a South East Melbourne perspective, we tapped in very early when we started looking at the service elements and the gap analysis. We asked young people what they thought was missing. What do you need? I think there was a forum you presented at with us, Craig, back in March, where we had several young people, and their insights were absolutely fascinating. But one of the things that they did mention, and it's just resonated with me ever since that forum, this young lady in particular said, it's great that we're sitting here and we're talking about designing services, but I guarantee you I'll either be too unwell or not well enough for whatever it is that we've got, because that's currently how it is. And so that's stuck in our head, and we think eligibility and access and all of those things need to be flexible and accessible for this cohort. So that was in terms of understanding what the gap analysis is. We then brought another group of young people together to talk about the service elements. So obviously we'll only commission evidence-based interventions. So I think that's pretty clear, and the guidance documentation in particular that Orygen provides is very useful in that space. So we're not looking for organisations to say, oh, we found this fantastic evidence-based model, we want to try that. We're not about trying that stuff. It's more about how do you use those service elements where appropriate, but more about the flow and that client journey, whether it's a wraparound case management service, what is it that you're trying to do, and then how are those interventions appropriate for that young person. And they're very happy to tell you what they need and what they don't need.
And I think you're right. I think you touched on a really important point. I think, whenever we ask young people their opinion, they're generally pretty happy to tell us, what they think are, particularly those young people who maybe have been through a mental health service or something similar, and for some it's not been a positive experience. So in terms of, I guess, as service designers, we can learn from that process and obviously build on that knowledge and really help shape how we deliver services into the future. So I think one of the challenges often we hear about is how do we engage young people. So I'd just be interested to get your thoughts on that.
And I was literally just about to say the hardest thing to do is to engage young people. So I think if you have got that voice in the room, it's critically important that you actually listen. We all tend to talk a lot. I'll put my hand up, I do like to talk. But I think you will certainly learn more by listening. And engagement, it's so difficult to engage young people. So if you haven't got the service design element right, and it hasn't been informed by a young person, they'll come, but they won't stay. And for this particular cohort, who have been, I guess, I wouldn't say necessarily neglected, that's probably not the right word, but there hasn't been a service that's been designed for this cohort in existence to date. this is a rare opportunity in any country, quite frankly, to have the ability to be able to design a service for young people informed by young people, so that you know that if you build it, they will come, whatever it may be. I think it's really important to listen to them.
And I think maybe one of the things just touching there, and certainly what we've heard from young people, is that they say that there's different ways of engaging young people. So I think some of us, and maybe I include myself in this, is that we think of, it has to be in a face-to-face, type of environment, whereas young people often tell us we're actually happy to comment things online, because they're, much more familiar and comfortable with an online space, that if we're designing things or have particular ideas about what a service might look like, they have no problem with, if that's in a written format, that, if there's capacity to look at that online and in an online environment and comment, in an online space, that's something that they're, very comfortable with doing. So I think partly the challenge is for us as, providers and service designers to think a bit outside of our own sort of comfort zone in how we engage young people.
Agreed. And I think we also need to respect the fact that young people are as time poor as we are. So to expect them to be able to turn up to a meeting at 9 a.m. in the morning, or take a day off work or university or whatever it might be, is unrealistic too. So I think using whatever means possible and medium to engage with young people is fantastic. We're sort of in terms of where South East Melbourne are in terms of the commissioning wheel that we all drawing the circle that we all like to follow. We're at that design, so we've gone through the design side, I guess. We're now building the specifications, the go-to-market phase for us right now. And it's critically important before we finalise the specifications that young people feel that we've captured what they've told us on the journey. And then obviously they'll be on the panel in terms of reviewing the submissions. Some PHNs I've spoken to are a bit concerned about having young people on the panel. It might expose them to well, I'm not sure what they think they're going to be exposed to, but from our perspective, we think it's really important that they have an opportunity to choose the provider in the organisation that's going to deliver a service for them. And obviously it'll be appropriately supervised and so on. And people will be interviewed beforehand to make sure they've got the capacity to be able to sit on a panel at that level. No,
I think that's a really critical point, and I think, that's, again, it's, I guess what you're talking about is involving young people, from the very start of that process right through to selecting an organisation who is actually going to be delivering that service. So I think that's a good example of how that process should actually work. So maybe we might move on to talk now a bit about, I guess, the role of commissioners. So once you've actually gone through a commissioning process and then you've contracted a provider, this is another, I guess, contentious, not so much contentious, but I guess, again, there's different sort of interpretations about the role of the commissioner and, what commissioners do in terms of supporting organisations. So are you a contract manager, or is it actually much more than that?
So it is definitely much more than that. Whilst we do have a contracts management team, I think it's really, really important that the PHN stays engaged with the organisations that they for the services that they procure through these organisations. In particular, and I think it's true of anything that you do, implementation is critical. So if you're not there and supporting that organisation to implement whatever it is you've procured, you're more likely to fail. I think that's just a given. We all always underestimate, it doesn't matter how long you've been doing these things, how long it takes to implement whatever it is you've procured. And then there's the time pressures, obviously, to deliver to various contracts, and we're all on this perpetual wheel of this has to be done by this date and there's deadlines. But I think at the end of the day, it's important that you do it well. And I think everybody understands if you said it's the 1st of August and it's the 1st of September or October, that's okay, as long as you get it right. So from a commissioner's perspective, from South East Melbourne, once we have awarded the tender, we then sit and work closely with the contracted organisation. We'll work through a contractor working evaluation plan immediately, so that they understand what's expected of them and vice versa. And then we'll go through an implementation plan with those organisations and work through that, obviously workforce and recruitment being critical, and then any training and capacity building that might need to be done. Where we don't necessarily have the in-house expertise, we'll actually go outside and find it and invite people into to support implementation. Once the service is implemented, then we like to give it a 6-month sort of period to get embedded, because obviously you're not going to be able to have a look at those outcomes too early.
Yeah.
There won't be any, particularly in the mental health space. And we're not really interested in the number of clients going through a service.
Yes.
We're really looking at the outcomes for clients.
Yeah, absolutely. Yeah.
So we, in the early stages of what we have done, we have supported organisations through implementation and then through the early delivery phase. And given that the interventions are evidence-based and are not new, but the way they're delivered and how they're delivered is different.
Yeah.
So you're asking practitioners in particular who have practiced a certain way for a number of years, either through ATAPs or MANIP, where it's 6 sessions, 6 sessions, 6 sessions, to think differently, to think about a step care model and to move that client up and down. So I think you need to stay in touch with those organisations and have communities of practice where you can bring the practitioners together and they can learn from each other, not necessarily from us.
So part of this is it is about a change process, isn't it? In terms of if we are thinking about how we deliver services to young people, it may be delivering it differently to how it's been done in the past, particularly if you're talking about, as you say, we try and look at what the best available evidence is. And certainly, I guess one of the things that we've looked at in relation to delivering services to young people is what's called, clinical staging. So again, recognising that young people will need different types of interventions depending where they are in that sort of staging continuum. So thinking about how we actually deliver the type of program that's most appropriate and the intensity, and the length of time that's delivered are pretty critical in determining that, the best possible outcomes for young people.
I completely agree, and I think that's where the step care model that all the PHNs have now implemented plays that critical part. So, youth severe and complex mental ill health is no different to the other services that we've procured. That's the beauty of the step care model. But it's important at the same time, whilst we say we have a step care model, that practitioners understand we have a step care model and they don't work in isolation with this cohort and think, and not be afraid to let go. It's okay if the young person needs to step down or step up. They'll come back if they need to. But it is change management. It will take time. But it's critically important that we work with organisations and give them the opportunity to go through those various stages themselves.
So would it be fair to say that part of a PHN's or a commissioner's role is trying to, I guess, enable and facilitate particularly the organisations that you contract, that really it is about working alongside with them, recognising, as you say, implementation is always a challenge, and so the time spent in supporting organisations through that implementation phase is absolutely critical. And I think what we know from implementation science is that 80% of programs fail in that implementation phase. So the time that is spent with them during that period is absolutely critical to that program succeeding.
Look, it is, and I think this is a new space for a lot of us, but I think it's important that we, from the outset, that you have with your service providers, once you've established that relationship, to work under the guise of continuous improvement. So whilst you might have a contract in place, clause 6.2 says you shall deliver X, Y, and Z, it's understanding that, well, actually you couldn't, because we know there's demand, but maybe the market, as not the providers, but certainly the clients, just didn't know the service was there. So have you promoted it well enough? Do we know, what are the barriers to the success of what we all agreed and the panel signed off and thought was a fabulous service? It just isn't working. So I think it's important that you sit with the service providers in the early stages to unpack why it isn't working, and to learn from those mistakes, and in a continuous improvement platform work through how to enable that service to deliver on its key objectives. Obviously you'll get to a point where for whatever reason it's just not going to work, and that's where decommissioning comes in. But we try not to talk about that in the early stages. We like to think that we've taken all the necessary steps to make sure the services succeed, and I think it's about having the flexibility to be able to say, okay, we commissioned it this way, we procured this service, but it needs to be adapted because the local community just isn't responding. And that's okay.
And I guess the flip side of that is that, and I think one of the strengths of this type of approach is that, particularly if you're delivering a service and during the sort of service delivery phase, the organisation who's delivering that service identifies a whole range of other needs as a result of seeing young people that are coming through their doors, can work with you to say, okay, we've identified this as a huge service need. Is there capacity for the PHN to actually potentially make an investment to provide this component of a service model? So I think that's one of the the flip sides of that, is that there's that really great capacity to be able to evaluate, if you like.
Absolutely. And it's always not about actually additional funding either. So, for example, we had a recent success with one of the programs that we commissioned, our accessible psychological interventions. In one particular LGA, the demand is far exceeded what we had anticipated, despite the data. So that organisation's been very successful in terms of promoting themselves and this service to the residents in that particular LGA. So we've had to look at, there's not additional funding for it. So how else and who else can we use, and what other services are there to be able to meet the needs of this client group until such time as this organisation has capacity. And I think that's important when we procure a service, particularly for young people, that we then also link them up with the other services that we've provided in that catchment, and then spread the capacity and build the capacity of the entire community, and not just the organisation we've procured.
So I think another valuable point in terms of that, the role that PHNs in terms of joining up different organisations and looking at that, I guess, service integration, if you like, because we know that, traditionally we tend to operate in silos. So how do we sort of break down that sort of silo thinking and actually work in a much more integrated way?
I think it's particularly challenging with this client group, given the risk element associated. So I think in particular for general practice, there are some challenges there, but I think we've recognised what they are. So now it's a matter of working through how best to address them. And we won't be able to do it everywhere immediately. This is early days in this space, but I think it's important that you acknowledge that the barriers and the challenges are there, and then have a plan to address them over time.
Okay, so you touched on this earlier, but in terms of, I guess, one of the things that, when setting up a program is that you look at ideally outcomes, what are some of the sort of impacts and outcomes of these sort of new programs that you are commissioning? What role or what sort of process, I guess, do you utilise in terms of looking at that from a PHN perspective?
Sure. So we have developed an outcomes framework for pretty much every service that we procure. And then obviously there's the PMHC-MDS, so we're obliged to collect certain data set.
Which stands for?
Primary Mental Health Minimum Data Set.
It's
not it's not a minimum data set by any stretches of the imagination, but it is what it is. And again, another challenge in commissioning is getting organisations to adapt their software and obviously to pick up all of these service elements. In particular, so there's the minimum data set that's set out by the Commonwealth, and then obviously depending on what you're procuring, there might be other little service minimum data set that you want to collect on top of. So there's also the challenge of getting these organisations to adapt their systems to do that, which is interesting. But without demonstrating the outcome, you can't keep reinvesting in something if you can't demonstrate the outcome and the value for that. So we have an evaluation team, so we do a lot of internal review and evaluation of our services, and we're very clear what the outcomes are that we're trying to achieve. So for this particular cohort, obviously the client will determine what outcome they want to achieve in terms of what they want to get out of that service. So whether it's improved functioning, return to work, re-engagement with school, whatever it might be, I think it's really important that we understand what it is before you deliver the service. And it will be different for every client.
And I think that's one of the challenges too, in terms of, I think we're traditionally good at measuring activity, like good at, a lot of services have been traditionally funded around activity based. But I think what we in this space, what we really want to try and move towards is looking at what is the impact of a young person accessing the service, but more importantly, what outcome does that then have on the young people? But not only the young people, for clinicians, clinicians need to know, is the work that I am engaged with that young person actually making a difference?
That's right. And I think, and that's a really important point, Craig, because I think people work in this space in particular because they want to improve the outcomes for young people. It's an emerging workspace in terms of there are so many now different areas that you can work in. So initially it was just headspace. Now you've got headspace and early psychosis. Now you've got headspace, early psychosis, youth severe. And traditionally you could only get that in the tertiary services. So it's great to be able to have that in primary care, and people are attracted to it because you can demonstrate the outcomes. So whilst the numbers of people coming through the service obviously is important for renewed funding, I guess we all think about that. We are definitely more interested in the outcomes for clients. And so I think in designing and building your service, you obviously need to make and have an impact and reach as many as you can. But again, it's not that confetti mentality that it's just about the money. It's about actually making a positive difference, a demonstrable difference.
Absolutely, yeah. So maybe we might move now on to just, I guess we're nearing the end of our session, but it'd be good to just, I guess, as you say, this is a new space. Everyone's learning from what they're doing currently. Are there particular lessons that you've learned along the way in terms of, the commissioning process and having, contracted different providers in terms of delivering services on your behalf? What do you see as some of the lessons learned along the way?
I think market readiness for whatever it is you're going to market for. I think we underestimate the capability and capacity of organisations to keep putting their hand up for delivering of new services. So I think you need to have your commissioning calendar well set and think about, well, when are you going to market and who's going to be able to respond? So traditionally speaking, I mean, for these types of services, you have to be well known in the community. You have to have those links to obviously make those referral pathways easier. So you are looking at a certain number of organisations that exist currently and their capacity to continue to put their hand up for tenders and deliver. So I think we really need to nurture that market and build their capacity as much as you can before you go to market. So that would be the first thing. I think the second thing then is implementation, we touched on earlier, and having a team or a number of people that are ready to just dedicate their time to implementing the service with the organisation. I think just giving somebody a contract and guidelines and saying off you go and we'll review you in 6 months, you're doomed for failure, quite frankly. So you need to build your own capacity internally to be able to do that. And then obviously the time it takes to get a new service off the ground. I think be realistic because it's never what you think it is. It's never less than 3 months. It's certainly more than that. And then understanding that if an organisation, for whatever reason, has recruitment issues or whatever it might be, working with them to try and circumnavigate that. So there would be some of the, I guess, the key learnings for us. I mean, going back one step further than that, I think is if you're going to market on a regular basis, if you're procuring services, it's to do it in a consistent way. So not change your system, not change your templates. Not change process too much because it's difficult.
So it's about that consistency, I suppose.
I think so in every aspect.
And I guess one of the challenges too, I'm thinking about, obviously you're delivering services in a large metropolitan region, but we know, some people watching today are probably from rural and remote parts of the country where there isn't a market.
That's right.
Where there may be one provider or there may be half a provider, so to speak. So, I think, it's quite a different environment where you're, if you're in those spaces where you're trying to sort of procure services, but you have one provider. But that one provider might be a very competent and capable provider. So probably at the end of the day, it's about how you work with them in ensuring, implementation of good programs.
Look, it is, and the challenge is certainly in the rural and remote areas of the country, and obviously the diversity of the population as well will play a big role in terms of who you can procure services from. But it's not like services don't exist today. So there are some services there, and I think this is again leveraging from the services that are currently there, and then building their capacity to potentially deliver to this cohort, because you just can't manufacture service providers, so you have to work with what you've got.
Absolutely. And I think, we've seen that, as I said, in this space. 10 years ago, youth mental health was, a relatively new phenomenon. There were very few providers. Now, we have 100, or we will have 110 headspace centres probably by the end of the year, and a number of other youth mental health programs being delivered around the country. So, in 10 years, we've seen the landscape change enormously.
We have, and I think if we look forward to the next 10 years, it'll be interesting to see, where we've landed. But I think we can't underestimate the opportunity that we have. I think it's incumbent upon all of us, so PHN service providers, Orygen, Headspace, to really work together to make sure that this initiative works. Because if it doesn't, we won't get a second bite of the cherry.
Absolutely.
So that would be
and I think, one of the important points that you touched on before is traditionally that, and particularly from a young person's perspective, is that they've not had access to services in this space before. Headspace was set up primarily for mild to moderate presentations, and so young people with more sort of complex or challenging types of presentations didn't have a service that they could readily
That's right.
access. State and tertiary services are fundamentally at the very pointy end, if
Yeah.
you like. So there was this very big service gap, and now there's this unique opportunity to really provide a much more comprehensive service response to young people right along the spectrum.
Absolutely. And I think you'll find in your co-designing and collaboration work that you do early on in designing services, when you speak to the head of child and adolescent psychiatry at any of your LHNs or LHGs, we all have a different term in each state and territory, you'll find the burden on those particular services is immense.
Yeah.
And whilst they're funded at that pointy end, again, they feel obliged, I guess, to deal with this particular client group, but the outcomes aren't particularly positive because they can't hold these clients.
Yeah, absolutely.
So the tenure of service is short, intermittent, and not really designed for that particular young person. It's really sort of, we've patched you up for today, off you go, but here's my number if you need to come back.
Yes,
and I think that's sort of the area that we're trying to address.
Yeah.
I mean, obviously you can tell I'm not a clinician. I'm about operationalising services and making sure they work.
Yeah.
The clinicians on the ground will do the marvellous job of making sure that young people are well looked after.
Yeah. Okay, so I think we've covered a lot of territory today,
Yeah.
but are there any sort of final words of wisdom that you have, or sort of parting sort of thoughts about, I guess, if there's particular lessons learned so far, or how we might do things differently, or...
I'm not so sure we would do things differently. I think it's probably a little bit too early for us to say we would do things differently. I think I would... if there's any advice that we could give, is to talk to your PHN colleagues. If you're a PHN, if you're a service provider, I think you would speak to your other service providers. I think whilst it is a competitive market, I think there's an opportunity for everybody to share their learnings to date and get themselves ready to be involved in this space. The second thing I would say is to all the links or the opportunities that you have to work with Orygen and Headspace in particular, and that expertise that you bring to this particular field should be received and taken up where you can, whether you're a service provider or you're a PHN. And I think the last thing I would say is, again, it's a fantastic opportunity for us collectively to make a huge impact in this space, and I think we need to seize the day and make sure we do it justice.
Perfect note to end on. Thanks for your time today, Kira.
Thanks, Craig.